Some people believe that men are more likely to suffer from heart disease than women. On the other hand, it is the leading cause of death in the United States for both males and females. Because certain signs of heart disease in women can be different from those in males, women may be unaware of what to look for. Manifestations of a heart attack in females. A chest pain, pressure, or discomfort that lasts for more than a few minutes or comes and goes is the most prevalent sign of a heart attack in women. This symptom is the same as the one that is most common in males. However, chest pain is not always severe or even the most visible symptom, especially in women. This is especially true in men. Pressure or tightness is a common way for women to describe the pain of a heart attack, and it is possible to suffer a heart attack without experiencing any pain in the chest. Heart attack symptoms that are not related to chest pain are more common in women than in males. These symptoms include: the soreness may be felt in the neck, jaw, shoulder, upper back, or upper belly abdomen. Having difficulty breathing. Discomfort in either one or both of the arms. Symptoms of nausea or vomiting. The act of sweating. Unsteadiness of the head or dizziness. A peculiar exhaustion. Reflux of the heart indigestion. There is a possibility that these symptoms are not as clear and visible as the crushing chest pain that is typically associated with heart attacks. This may be because women are more likely to have blockages not only in their main arteries, but also in the smaller arteries that supply blood to the heart. This condition is known as coronary microvascular disease or small vessel heart disease. It is more common for women to experience symptoms when they are resting or even when they are sleeping, in comparison to men. There is some evidence that emotional stress may play a role in the onset of heart attack symptoms in females. Women may be diagnosed with heart disease less frequently than males. This is because the symptoms of a heart attack might vary from person to person. When there is no substantial blockage in an artery, women are more likely to experience a heart attack than males. This condition is known as non-obstructive coronary artery disease, NCAD. When to make an appointment with a physician. Please contact emergency medical assistance as soon as possible if you are experiencing signs of a heart attack or if you believe that you are having one. If you do not have any other methods available to you, you should not drive yourself to the emergency department. Risk factors for cardiovascular disease in females. Both men and women are susceptible to being affected by a number of the classic risk factors for coronary artery disease. These risk factors include excessive cholesterol, high blood pressure, and obesity. However, other factors may play a more significant influence in the development of heart disease in females. Among the risk factors for heart disease that women face are: it's diabetes. A higher risk of developing heart disease is associated with diabetes in women than it is in males who have the condition. There is also an increased risk of having a silent heart attack, which means that there are no symptoms associated with it. This is because diabetes can alter the way that women experience pain. Both depression and emotional stress are real. Depression and stress have a greater impact on the hearts of women than they do on men. Maintaining a healthy lifestyle and adhering to the treatment recommendations for other health disorders can be challenging for those who are recovering from depression. Engaging in smoking. Women are more likely to be at risk for developing heart disease than males because of their habit of smoking. There is no activity. One of the most important risk factors for cardiovascular disease is a lack of physical activity. The menopause. Following menopause, a decrease in estrogen levels is associated with an increased likelihood of developing illness in smaller blood vessels. Pregnancy problems. When a woman has high blood pressure or diabetes during her pregnancy, it can increase the likelihood that she will develop high blood pressure or diabetes in the future. In addition, women who have these diseases have a higher risk of developing heart disease. There is a history of early heart disease in the family. This appears to be a risk factor that is more prevalent in females than it is in males. Inflammatory disorders. Inflammatory disorders, such as rheumatoid arthritis, lupus, and others, have the potential to cause an increased risk of cardiovascular disease in both males and females. The risk of heart disease should be taken seriously by women of all ages. It is also important for women under the age of 65, particularly those who come from families with a history of heart disease, wellness practices, and natural cures. It is possible to lower one's chance of developing heart disease by adopting a healthy lifestyle. Put these heart-healthy strategies to the test. Give up smoking. Stop smoking if you are not already a smoker. The inhalation of secondhand smoke, which can also cause damage to blood vessels, should be avoided at all costs. Eat a nutritious diet. Choose lean meats, fruits and vegetables, low-fat or fat-free dairy products, and whole grains as your primary sources of nutrition. Avoid foods that are heavy in salt, added sugars, saturated or trans fats, and other unhealthy fats. It is important to exercise and keep a healthy weight. If you are overweight, shedding even a few pounds can reduce the likelihood that you will develop heart disease. Inquire with your healthcare physician about the ideal weight for you to maintain. Control your tension. The constriction of the arteries that can be brought on by stress can lead to an increase in the likelihood of developing cardiovascular disease, particularly coronary microvascular disease. Increasing the amount of physical activity you get, engaging in mindfulness practices, and participating in support groups are all strategies to bring stress under control. Limit or stay away from alcohol. When you do decide to consume alcohol, make sure to do it in moderation. For people who are in good health, this means that women can have up to 1 drink per day, while men can have up to 2 drinks per day. Your treatment plan should be followed. Medication, including blood pressure drugs, blood thinners, and aspirin, should be taken exactly as directed by the doctor. Other health issues should be managed. Diabetes, high blood pressure, and high cholesterol all contribute to an increased likelihood of developing heart disease. Exercise and the health of the heart. Maintaining a healthy heart requires regular physical activity. As a general rule, you should strive to complete at least 30 minutes of moderate activity on most days of the week. This could include walking at a brisk pace. If that is more than you are capable of doing, begin slowly and gradually increase your intensity. Exercising for even just 5 minutes every day can have positive effects on one's health. If you want to see a more significant improvement in your health, you should strive to engage in moderate to intense physical activity for around 60 minutes each day, 5 days per week. Also, make sure to perform strength training activities at least twice per week. In a day, it is acceptable to divide your workouts into multiple sessions of 10 minutes each. You will continue to receive the same benefits for your heart health. The practice of interval training, which consists of alternating short bursts of intensive activity with intervals of lesser activity, is an additional method that can be utilized to maintain a healthy weight, improve blood pressure, and provide cardiovascular health. One way to incorporate running or rapid walking into your regular walks is to incorporate brief bursts of these activities. Your everyday activities can also include physical activity if you follow these guidelines. Rather than taking the elevator, please take the steps. You can get to work or run errands by walking or riding your bike. Maintain a stationary position when viewing television. Treatment of heart disease in female patients. In most cases, the treatment for heart disease in men and women is comparable to one another. Medication, angioplasty, stenting, or coronary bypass surgery are all potential components of this treatment. Several notable distinctions between the treatment of cardiac disease in men and women include the following. Aspirin and statins are treatments that are less likely to be administered to women to prevent future heart attacks than they are to males. Studies, on the other hand, have shown that the advantages are comparable in both groups. When compared to men, women are less likely to need coronary bypass surgery. This could be because women had fewer cases of obstructive disease or smaller arteries, with a higher prevalence of small vessel disease. Recovery from heart illness can be aided by cardiac rehabilitation, which can also enhance overall health. Men, on the other hand, are more likely to be recommended for cardiac rehabilitation than women are. So this is the end of our today's video. Do you like it? Kindly give your valuable response in our comment section below, and don't forget to subscribe to our YouTube channel for more interesting and informative videos.